So this is the parts of pediatric course. Especially today we will see about what is pediatric history and physical examination. So before going into details, we are focusing on what is the difference between adult history versus pediatric history. In pediatric history, mainly we are focusing on content. The content difference of pediatric history, especially, for example, in pediatric history, mainly we are emphasizing or detailed history can be gathered from perinatal, and birth history is one of the most crucial parts of pediatric history. The other parts of pediatric history, which is different from adult history, and developmental history, or what is the age and developmental history of the pediatrics. Especially, it's the best way to assessing the pediatric client patient. Especially, we are focusing on developmental history is one of the most crucial parts of the history of pediatrics. The other things are social history of family, especially environmental risk factor, which may exposing a child for health problems. The other parts of the content difference of pediatric history from adult ones, especially in adults, we are not emphasizing on immunization history, but immunization history is the most important crucial parts of pediatric ones. And during pediatric history, mainly we are focusing on what and when the child who goes immunization or vaccines. Also, we are assessing the immunization history of his mothers, which was the most important parts of pediatric history. The other difference of adult versus pediatrics, or pediatrics versus adults, parents are historians in pediatrics age groups. They are collecting or gathering the most important history or the clinical feature of a child from his historians or from his caregivers. So we are a better way to gathering the most important clinical feature or sign symptom from his caregivers. So parent interpretation of sign and symptoms. The other, the best chance to be observing parent-child interactions, and parent behavior or emotions are important for pediatric history than adult ones. So in detail, the outlines of the pediatric history after observing the difference of pediatrics history and adult history. This is the outlines of pediatric history. The first things are identification history. On identification history is mainly we are focusing on name of child, age and sex. And the other component of biographical data, we are using a parent or the caregivers biographic data, example, religions and occupation. The other components of pediatric history, chief components. Chief components are those signs and symptoms which prompted the family or parent to seek medical advice, and a factor which may be which you use for bringing or parting a child for medical advice in health facility, which is chief component. The duration of each sign and symptom should be clearly indicated in chief complaint, and the numbers of sign and symptom, which is not more than 2 to 3. But in chief complaint, always we are using the words of client or patients, and we are not using the diagnostic words or medical terms in chief complaints. The chief complaint, for example, Example of chief complaints: a child presenting in our health facility with fever, vomiting, headache, and cough for 0-3 days. This is not medical terms, and simply what the patient thoughts, and the duration of sign symptom which we elaborated in details. So remember, chief complaint don't use medical terms or diagnosis. The other parts of pediatric history of present illness, which is the most important parts of the history. History of present illness is a chronologic descriptions and duration of the chief complaints. We try to answer the following question: chief complaint, especially what is the duration of a disease or disease onset. Duration is the most important to classify the disease after the end of and during the planning times, and the severity of disease, and what aggravating or alleviating factors, when maybe the sign symptom resumes or solved after what the child may taking, and what's the aggravating factor of the present illness or problems, and what's related factors or associated symptoms of the disease, or any drugs or any treatment and response to treatments, and history of contact with similar illnesses. It's very important thing. Is there any contact with other person with the problem of similar with the presenting illness? This is a crucial parts. And the other parts of pediatric history is past medical history. It's made up of the illness the patient has had in the past, and medical history of pediatrics contains and major medical illnesses. And it's a very important part of these components of pediatric history, especially to have a child had history of medical illness previously, or surgicals, or trauma, fracture, or laceration in the previous hospital admissions with death and diagnosis. Very important in pediatrics history. And what's the current medications, what types of drug or medication can child or took, and knowledge of allergy. This is a very important thing. On pediatric history, we are not focusing on drug allergy, because due to the immune response of the children, the majority of the pediatrics age groups not respond on a drug reaction, so that drug reaction we are not focusing on it. So other reaction, other factors, it's very important to assess in part medical history. The other parts, we are on the pediatric history. Mainly we are focusing on pregnancy and birth-related history. For example, maternal health during pregnancy is very important. And the mother had bleeding, trauma, hypertension, fever, infection during pregnancy, and directly those factors may affecting a fetus in uterus, or maybe this problem can be go through the lifespan of the children. So that's better thing to be assessing maternal problem during pregnancy is a very important parameter for assessing pediatric history or health of the children. And gestational age at birth, and at what gestational age of the present child be born. term, preterm, or postterms. Majority of preterm neonate or preterm childs or neonates mainly affected by different physiological and pathological conditions because of their immature body systems or defensive mechanisms. So, gestational is the best parameter for assessing childhood problems. The classification of gestational age. Gestational age from the age of fetus in utero from conception up to delivery, which is known as gestational age. The normal gestational age in normal births from 37 up to 42 weeks. If a newborn born before 28 weeks of gestation, which is known as abortion. From 28 up to 37 incomplete week of gestation, which is premature fetus. From 37 up to 42, which is normal or term, and beyond 42 week of gestation, which is post-term. The mortality rate or problem related to gestational age. Majority of health and health-related problems mainly affecting a newborn at the gestational age less than 37 weeks of gestation because of immaturity of body systems or organs and immunity. So, gestational age is the most important parts of pediatric history. And also we are assessing labor and delivery. What is the length of labors? What time takes a labor? That the normal duration of labor, it is accepted duration of labor, which is labor start and completed within 18 hours. If beyond of 18 hours, maybe post prolonged labor. Like with the prolonged labor may be exposing for different pathological organisms, so that maybe a newborn may get infection or intrauterine infections due to prolongation of labor. And also we are also assessing on labor and delivery, does the fetus had distress or breathing problems, and also types of delivery, and maybe a CVD or cesarean section or an instrumental. This is important to assessing breathing factors of the newborns. Or does the mother used, or the mode of delivery may be cesarean section, anesthesia, which may affecting respiratory center of the newborn, so that is better thing to be assessing those factors. And types of delivery, special bridge delivery may have main risks or complications like fracture of bones, breathing problems, so that is better thing to be assessing mode of delivery. And after giving of birth, we are also focusing on neonatal period. Neonatal period, neonatal period means age from birth up to 1 month. We are mainly assessing on AFCAR score at the first 1 and 50 minutes. AFCAR scores: appearance, pulse, grimace, activity, and respirations. It's very important, crucial parts of pediatric assessments, neonatal assessments. If AFCAR score less than 3 and severely asphyxiated, and 3 up to 6 moderately asphyxiated, and 7 to 10 is normal. So that mainly asphyxiated newborns have majority of his organ may be affected. For example, kidney near to 50% of kidney impairment due to asphyxia. So that brain also permanent damaged by lack of oxygen, which is the most important crucial parts of neonatal assessment. AFCAR score is important parts, so that always you are giving an emphasis on assessing or checking the AFCAR score of newborns. Breathing problems or use of oxygen after delivery, need of intensive care because of different factors, or a child with hyperbilirubinemia, which is excessive amount of bilirubin in the system, which greater than 12.5 mg per deciliter for terms, and greater than 50 mg per deciliter for preterms. When maybe hyperbilirubinemia means the liver or intestines unable to excrete harmful substances because of immaturity of an organs, and birth injury, feeding problems, length of stay in the hospital, and birth weight is crucial. Birth weight is the normal birth weight of newborns from 2080 grams up to 4000 grams. Special age less than, weight less than 1000 grams, which is very extremely low birth weight, 1000 up to 1500 milligrams, very low birth weight, and from 1501 up to 2500 it's low birth weight, 2500 especially above the normals, especially from 2800 up to 4000 grams, we see that normals. Mortality rate of newborns, especially the weight of newborns at birth decrease, the mortality and the morbidity is high as compared to normal birth weights. And the morbidity and the mortality of newborn increase when the weight of newborn greater than the normal weight, which is greater than 4000 grams than normal weight of newborns. So the minimum weight or postnatal weight of newborns, which is 2800 grams. The maximum is 4000 grams. Below 2800, which is low birth weight, and greater than 4000 grams is large for gestational age. So the other parts of pediatric history, immunization history, which is a very important part for assessing immunization history of both mothers and her child status. Be specific, always be updated on what and when the child take or took a vaccine, and the mother also. The other parts of pediatric history, developmental history, age at which milestones which are achieved and current developmental ability, like smiling, rolling from, sitting alone, crawling, walking, running, words, toilet training, riding of bicycle, etc., which is important, which directly correlated with developmental history of newborns. School present grades, specific problems or interaction with peers, or the child may fight with his peers or not. It's very important parts of pediatric history, especially developmental history. What's the behavior of pediatric age group or child, like enuresis or maybe involuntary loss of urine at night times, or aggressiveness of child, or sucking of thumbs, or maybe desiring of unusual foods, like eating of soils, maybe sometimes nightmares, especially, which is a behaviors, which is maybe which may indirectly indicate that psychological impairment of newborn. So developmental parts of the history is very important for pediatric assessment. So the other parts which in the pediatric history, especially nutritional history, we are focusing on nutrition, especially for age up to 6 months. The most important nutrition for neonate is breastfeeding, and it's better to assess the child may get or the mother may feed breast or bottle feeding, or what types of formula the mother used, frequency and amount, reason for any change in the formula, why the mother changed from breast to formula, and maybe the mothers or caregiver providing or introduced solid foods, and what's the current history, because the eating behavior may be affected by different illnesses. So that's a better thing to assess the problem during feeding. That is important parts of pediatric history. The other parts of pediatric history and family history, like family illness, is important. Maybe the illness of family which may affecting child development and growth, like a cardiac disease. If a family, especially his mother, had history of cardiac disease, hypertensive, stroke, diabetes, cancer, maybe those factors which may affect the growth and development of children. So that's better thing to be assessed. Mainly, you are emphasizing on those factors. And maybe mental reduction or retardations, congenital anomaly, chromosomal problem, growth problems, ethnic background is important part for maybe some special diseases or problems maybe interrelated with chromosomally from, or maybe inherited from his genetics. So that is better thing to be mainly emphasizing on these parts. And social history, especially this is a pediatric history, it's mainly good factor which may influencing child growth and development. One is social history, living situation and condition, and where the child may stay, or in the daycare, safely issue, and composition of family or numbers, occupation of parents, what's the monthly income of parents. So this is the important part of pediatric history. On pediatric history, like review of system is important, like weight and recent change, weight at birth, skin and at lymph nodes, rash, adenopathy or swelling of glands, limbs, bruising and bleeding, pigmentational changes in the skin, hint, headache, concussions, unusual head shapes like box-like structures, conjunctivitis, visual problems, hearing, ear infection or draining ears, cold and sore throat, tonsillitis, nose bleeding, so on. On cardiac, especially it's better to assess cyanosis, especially blue discoloration of skin and mucous membrane, dyspnea, which is difficult breathing, or exercise tolerance, or maybe a child unable to perform daily activity because of factors. And squatting, it's a better thing to be assessing a child when playing with teammates, especially squatting with frequently, which is maybe it's better to assessing the problems hearts. chest pain and palpitations. On respiration parts, we can assess breathings, maybe any abnormal sounds or cough. GI system, maybe it's better to check stool colors, characters, maybe diarrhea if the child had diarrhea and had constipations, vomiting, or vomiting which contains blood, maybe abnormal color of stools, abdominal pain, colic, and appetite, which is better laboratory assess during GI gastrointestinal assessments. Genitourinary systems, it's better to assess the frequency of urine or difficulty of urination or blood with urines or abnormal discharge, unexpected discharge from urethra, pain, quality of urine streams or amount of urine, maybe polyuric or excessive amount of urea, maybe infection or facial edema, because the better way of assessing some diseases which may causing edema, especially facial edema, maybe acute glomerulonephritis or nephrotic syndrome, which is the most important thing to assess a child with those problems, especially we are focusing on edema. Musculoskeletal systems, joint pains or swelling, fevers, scoliosis or abnormal deviation of spinal cords, malacia, weakness of muscles, joint pain, cat changes, special movement problems. This is deformity on the skin, skeleton. It's important to assess child problem. Pubertal stage, especially assess secondary sexual characters, especially menses or menstrual problems, pregnancy or sexual activity of both male and females. Allergy, especially urticaria, hay fevers, allergy rhinitis, asthma, drug reaction, which is a good part for assessing pediatric history. So, in general, as a revisions, the contents of pediatric history. So, this is your home take assignment part. So, all students, you have an handouts, and you have took history and physical assessment of adults, so that it's better to do individual assignment on pediatric history, especially by using these contents. So, this is the parts of pediatric history. It's revisions, personal letter, it is bibliography, source of referral, source of history, previous admissions, chief complaint, history of chief illness, pregnancy and birth history, past medical history, family history, social history, immunization history, nutritional history, developmental history, and lastly, review of systems. So students, this is all about the contents of pediatric history. This is the parts of pediatric history and physical examination. Especially today, in the part 1, where we see or observed the pediatric history. Thank you. Stay home.